Hello, my name is Michael Morawski, and I am the System Chair for Nursing Professional Governance at Jefferson Health, headquartered in Philadelphia, Pennsylvania. I would like to take a brief moment to review our internal Nursing Professional Governance page, which is the home for all things professional governance throughout our entire enterprise. Each nurse among our 33 hospitals and hundreds of outpatient locations has access to this page and can use it to stay engaged and informed regarding their care. As we begin, you will see a brief overview as well as hyperlinks to our monthly meetings, system bylaws, officers by council, and resources by location for easier access to the page. As I scroll, the monthly meetings section of the page becomes the first stop. Within this section, we have our agenda item request form, our monthly meeting packet, and our heads up, hands on, pass it on newsletter. The agenda item request form is a request for submission form that allows clinical nurses to submit their requests for agenda items at our monthly meeting. As you'll be able to see, we use an SBAR format to determine which council should be assigned the request and promote proper information distribution. We ask for various background information so that we are able to communicate most efficiently with the person who submits the request and ensure their request is fully understood, which is effective when facilitating discussion among MPG council members. In addition to the agenda item request form, we have our monthly meeting packet, which is collated to include all agenda item requests and released prior to our regional and system NPG council meetings, so that clinical nurses have the chance to review, research, and consider solutions and feelings towards any of the submitted requests. Finally, we have our heads up, hands on, pass it on newsletter. This form is updated after each system council and is used as an information, action, and dissemination document to inform all nurses of the work done by the council that day. This document is critical to promoting the work that our system MPG council does. Continuing down our Nursing One page, you will see resources such as past meeting minutes and attendance, our clinical decision implementation form, which tracks all of the work the council completes and allows us to follow up on work or decisions that are still outstanding. This allows for targeted ownership of different tasks and is useful as a log to allow council members to visually see all of the work they complete. Additionally, we have an NPG orientation page that is useful for new members and new to practice nurses as they begin their careers. At Jefferson, we consider participation in nursing professional governance a nursing duty for all of our nurses. Following the monthly meeting section, we have our system nursing and professional governance bylaws. These bylaws are the foundation for our governance structure and are reviewed yearly to ensure congruence between our charter and our actions. After bylaws, the website lists our MPG officers by councils, as well as facilitators and executive sponsors. We believe that nurses should know their leaders and be able to connect with them when necessary. We want to ensure an atmosphere of connection and inclusivity in all that we do, but especially within our nursing professional governance structure. Finally, as our MPG structure has both a system and regional level, we want to include a resources by location feature to allow our clinical nurses to most easily find resources that apply to their specific location. Although our overall goal is to improve coordination and consistency among all of our sites, regional differences may create times where complete consistency is not possible. As such, this section meets our nurses where they are and allows them the most up-to-date information that specifically pertains to them. At Jefferson Health, we use our nursing professional governance structure to promote the voice of the bedside nurse, to improve communication between leadership and clinicians, and create a culture of consistent, high-quality care. In essence, our MPG model allows us to embrace our virtue. We improve lives. Thank you for your attention today.